There are 5 risk signals for cancer. Cancer is the #1 cause of death in people these days. I'm really scared of this cancer. I need to take care of it well. I need to take good care of my health. And I'm working out hard, too. This cancer has characteristic common signs of danger. I'll look into that. Today's video is about cancer signs. Cancer symptoms that are common when you have cancer. And I'm going to tell you some of the characteristic symptoms of cancer, like brain tumors, thyroid cancer, stomach cancer, pancreatic cancer, liver cancer. First, there are over 200 types of cancer, and these are all different. But there are common symptoms. You need to remember these symptoms so that you can go to the hospital quickly when you have liver cancer, pancreatic cancer, stomach cancer, colon cancer, something like that. The source of this data is based on the data provided by the NHS in the UK. The first symptom of common cancer is sweating like rain and fever. It's not like that even if you catch a cold. It's not like the flu. It's like that. It's not a cold. It's not a flu. It's not a menopausal woman. But there's no reason. But you don't know why you're sweating and you're boiling. That's a common characteristic of cancer. So, especially when you have a high fever for a long time, and you don't have any symptoms of a cold, you should go to the hospital. This kind of indistinct fever is the characteristic part of cancer. The reason is that cancer spreads through our tissues, invades our tissues, damages them, promotes inflammatory reactions, and causes fever. Because it causes another inflammatory reaction with the cold virus. But even if you look at my neck, it doesn't stick. The second reason is that you're scared of a fever. That you don't know the cause is extreme. Fatigue and weight loss. It's the same pattern as usual. I eat well and sleep well. But it was so hard to wake up in the morning. The level of difficulty is I can't get up. It's not that it's hard to wake up today. It lasts for a long time. I lose weight but I eat the same as usual. But losing weight is a common symptom when you have cancer. I'm sure cancer draws all the energy. It pulls all the glucose. It pulls all the sugar in our body. And it grows as we clone it. So the energy in our body goes down. The cancer grows, and the weight goes down. So if you're accompanied by an unknown fatigue and weight loss, you can suspect cancer. And the third symptom is an unknown hemorrhage. Bleeding can be caused by nosebleeds, blood from the mouth, but it can come out of the urine. It can come out of the anus. And it can come out of the skin. It can come out with my eyes. It's a bad sign when you bleed to the ground. I don't know why. If you get bruised, if your skin is inflamed, if you get ulcers, or if your skin is bleeding. But if it lasts for a long time, you have to suspect cancer. If you don't hit anything, you get bruised, and you bleed, and then you bleed, and then you invade the tissue and damage the blood vessels. So you get external bleeding. So when you have stomach cancer, colorectal cancer, pancreatitis, pancreatic cancer, and so on, you get black or red stools. And if you have bladder cancer or urethral cancer, you see blood flow. If you have oral cancer, you'll bleed when you spit it out. And if your skin turns black, you can get cancer now. But you can get bruises or ulcers and get dug up. And you can get inflammation. These things can all be signs of cancer. And fourthly, there's going to be a lot of pain around the cancer. There's 5 headaches, 5 pains, a stomachache, a bladder, an anus, and then there's a pain behind the skin, which is obvious. But suddenly there's an unknown pain. I was usually fine and I don't think I'm particularly sick. But when the pain suddenly got unbearable, the cancer has progressed to some extent. So if you have pain, you must go to the hospital. You can look at it like this. Fifth, when you touch the lump, abnormally colorectal cancer, like I said, is touched by lumps in the abdomen. Thyroid cancer, skin cancer, breast cancer, side of the chest, and armpits, of course. Lymphatic cancer, when a monkey or something is caught, it can be a sign of cancer first. These symptoms can overlap with other diseases. I catch a cold when I have a fever or something like that. All you need is adrenal fatigue, thyroid disease, bleeding, bruises, side effects of nutritional supplements. But these are all very bad signs. That's why you need to go to the hospital whether you have cancer or not. But it's overlapping, and if I'm in my 40s or older, there's a possibility of cancer. It's hard to tell, but you have to be careful. Secondly, I'll tell you some of the characteristic symptoms of cancer in each of our parts. But not all of these symptoms are cancerous, and it could be cancer. So let's know. If you know it early, you can deal with it. So there's nothing to lose. I think it's good to look at it on that level. And the symptoms that occur when others attach to that area and multiply and invade, stimulate that area or disrupt its function, are characteristic signs of cancer in these specific areas. The first part of the head is probably a brain tumor. Brain tumors occur on the nerve side, on the meninges, on the brain. Tissues like the cerebellum and the liver. The common symptoms are motor functional problems caused by damage to the nervous system. Shaking hands or speaking. Shaking eyes. Blurred vision. Memory loss. Sleep disorders. Mood changes. And hormonal secretion disorders. It can be accompanied by symptoms and headache pain. Second, mouth cancer, oral cancer, hood cancer. If you have cancer inside your neck, like laryngeal cancer, it's going to be hard to swallow. That can happen. And when you have mouth cancer, it can be mouth cancer when the stomatitis lasts for a very long time, usually for more than 3 weeks. And the canker sore gets worse. The pain in the mouth gets worse whether it's oral cancer or pharyngeal hood cancer. It stimulates or blocks the vocal cords and neck, so your voice changes. And third, thyroid cancer. One of the most common cancers is that you often get lumps in your throat, and your voice changes. It becomes difficult to swallow, and it becomes difficult to swallow because the lump of cancer on the neck presses down on the esophagus, and you can get really tired and cough. And fourth, lung cancer on the chest. Cancer, lung cancer is also at the top. Your voice may change. You may have difficulty breathing. You may feel stuffy, and of course, your cough will last for a long time. I cough for more than a month. Not 2 weeks, of course. It stimulates your lungs and your compressive tissue gets bigger. So of course you can cough for a long time, and characteristically, blood may come out. In fact, it's good to note that if you have reflux esophagitis or if you cough for a long time, You can get a blood phlegm even if your airway is damaged. But I told you that it's characteristic. That blood phlegm comes out for a long time. If blood comes out, you have to go to the hospital, that's what I said. And you can think of it as having difficulty breathing and severe chest pain. And fifthly, breast cancer, especially in women, is the most common thing, where lumps are caught like mongrels. These lumps are caught up to the armpits as they progress. It's the most common thing to find, and it's secreted from the papilla, pus and blood, and on this side. There's a skin lesion on the breast side. Inflammation or eczema can cause skin lesions such as skin peeling, and swelling of the papilla or breast can occur. And sixthly, you can get cancer on your skin. Skin cancer is a big ulcer. So you can see that it's skin cancer that doesn't hit or hurt anywhere. But it causes deep inflammation. The color changes to black, and bruises often occur. And cancer in the 7th gastrointestinal tract, gastric cancer, esophageal cancer, liver cancer, pancreatic cancer, biliary tract cancer, etc. It's a very scary cancer in the stomach. High mortality and common symptoms can include stuffy pitfalls, bloated abdomen, nausea, appetite, and reflux esophagitis. But it's hard to tell these from stomach trouble. I think it's good to just refer to it. And it's hard to distinguish chronic indigestion and stomach aches because everyone has them. If it lasts for a long time, you can see a doctor. And as I said in my previous pancreatic cancer video, pancreatic cancer is a symptom of pancreatic cancer, characterized by radiating pain in the back, such as pain in the back and spreading to both sides, and yellow under the eyes, yellow in the whites of the eyes, yellow in the face, yellow in the nails, jaundice. Then jaundice can be a symptom of liver cancer, biliary tract cancer, pancreatic cancer. Of course, it could be caused by elevated liver levels, or it could be caused by biliary obstruction. But if you have jaundice, you should go to the hospital. Itchy skin is also caused by bile not circulating. But it can also occur when you have cancer. And I looked at the oil stool, and it comes out with a little bit of mushy mucus. And the white side of the stool is now grown. This oil change can also occur when cancer occurs in the conference. And if you see dark brown urine, cola-colored urine, you have to go to the hospital right away. It could be caused by rhabdomyolysis. But it could be jaundice. There are times when the bile is too strong, and the color comes out like this. And if jaundice and urine are weird, you have to go to the hospital right away. And the abdomen, I told you that 8th colorectal cancer can be characteristically bloody. The ascending colon side is also far from the workplace. So if you have cancer,